Hello, Robyn Kesnow, RVT, and founder of Animal RN. Today we're having a conversation about medication, and those don't really rhyme, but people, going with it. It's what I got. Okay, so conversation about medication. First of all, I want to be clear about who I'm specifically talking to. Today, I am referencing animals in the phase of life that I'm going to call animal hospice. They're at a point in life where we're being more concerned with absolute comfort care, with palliative care, comfort care, as opposed to specifically a more curative phase of life where maybe we want to push out every disease and really aggressively use the medicine and the tools we have available to cure disease. In this case, we're less worried about that. That may or may not happen based on our treatments, but we are really more worried about the animal being comfortable. Much less invasive, low stress. It's all about comfort and just saying, how can I do a little better, a little better, a little better, okay? All right, so that's who we're talking to. Now, here's our medication tips. Tip number 1, can we eliminate any medications we're already on? So that is my number 1 first tip. When we reach this phase of life, or if you've been here a little while and you haven't done this yet, my first tip is to go through, list everything you're giving, every supplement, every medication, everything that you do, sometimes, always, or rarely, anything that you're giving your pet. This could be a little probiotic you're sprinkling on the food and you don't even remember that you do it because it seems like it's more part of their food than it is medicine, or more of a supplement, to the crazy medication you're doing, to daily insulin or sub-Q fluids. List everything you're doing and go through, and based on our new mindset, or evaluating our mindset of palliative care, are there any medications on here that I can eliminate? And this is something you'll want to work with your veterinarian for. We just want to minimize the stuff we're giving. We're going to allow the body to do what the body does. We're still going to support it. It might be that when you evaluate your list, there's nothing that you eliminate. That's okay. Totally fine. It's going to depend on the individual animal. I just know that very often the things that we got into giving our young dog as a supplement may not be appropriate at this phase of life. So we're going to evaluate our medications. That's number 1. Tip number 2 is going to be whatever medications and supplements, etc., that we have left on our list after we've evaluated and eliminated everything we can. Our next thing is going to be, what is our priority here? If I can only do one thing, which one thing am I doing? And this is definitely something we want to work with our veterinarian on. And this might be something that, depending on what part of the process you're in and how long your animal is around, that might need to be reevaluated at whatever frequency. I'll talk more about that part later. But we want to see, if I'm only doing one thing today, what are we doing? If I'm only going to get in 2 things today, what am I doing? If I'm only getting in 3 things today, what am I doing? If I'm going to 4 things, first I want to go back and say, are we sure we really need it? I really want to push on that. It's not because 3 is some magical number, but just because if it becomes stressful to get this stuff in the body, we want to make sure that what we're giving gives the biggest impact. If we truly are in a hospice phase where this little body, we want it to be comfortable, it might be in some level of shutting down, I don't want to have it trying to process medications if it doesn't need to be. And yet, what it needs to process, I want it to have all the energy and all the oomph it needs to get what it needs out of this medication, right? So evaluate what you're giving and then prioritize that, okay? So those are our first 2 and probably biggest tips. Now, this is the fun of my job. This is the secret sauce that gets me called out, and how I meet a lot of families that we end up working with in animal hospice. A lot of times it starts with delivery of the medication, administering of the medication. We're giving a pill and we're having a hard time. Can you help us get the pill in the cat? Yep, certainly can. And I can do that. What often, not always, but often ends up happening is, as a part of giving that medication, I notice what medications we're on, and I have a conversation with people like, I'm going to use this baby I saw this morning, for example. This cat does not prefer to get oral medication, and yet we've evaluated what this baby's on, and this stuff is really comfort care. This really is controlling quality of life, and if we're not euthanizing, we need to get these things in this baby, okay? One of the medications can be delivered in a liquid, which is not all cases, but in this cat's example, would be a lot easier for the family to give. The cat would be much more tolerant of a flavored liquid. Not that he's going to sit there and lick it up. I'm not kidding you about that. That's not happening. But a little dropper just in the side of the mouth and getting the medicine in that way is more tolerable to this particular cat. And one of the medications he's on could be compounded. That's the term. Compounding pharmacy is what we need. By the way, total side note, if there's not a compounding pharmacy near you, there are compounding pharmacies that ship overnight and they're able to help you that way. So if you need that, let me know. Maybe I'll put a link to a couple of them here, but definitely reach out if you're having trouble finding a compounding pharmacy or your vet doesn't know somebody. We could definitely help you out with that. Okay, so first, one medication with this particular cat who hates getting pills could be a liquid, which would be much more tolerable to both the family and the baby. Okay? That keeps their costs down. They're not having to pay me to come over. They can just get the medication slightly differently, and this particular medication can be absorbed and bioavailable to that baby and processed, and no problem to be a liquid, okay? Another medication, another one of the pills that I'm being asked to give this cat, is available in an ointment that goes in his ear. And so the family, instead of having to shove a pill down the cat's throat, because he's no longer taking pill pockets and doing all the trips on that, watch my video on giving a cat a pill, or giving a cat oral medication, I think it's called. I'll see if I can find a link for you. Instead of trying to shove the pill into the cat, they could just be rubbing this ointment on the ear. They would have to wear some gloves. It again would be compounded by a compounding pharmacist, and it would be a very non-invasive way to get the medication into the baby. Okay? And then the last medication that this cat is on, which is a pill, which is being shoved down his throat right now because he's not taking it any other way, this one could be an injection. Now, I don't know if you've ever done this before. If you haven't, you might think that an injection, wait a minute, I thought we were trying to make this easier, not harder. For us as humans, taking an oral medication is a lot more benign, a lot less invasive than us getting a shot, right? So that's why we think that. It's entirely reasonable logic. And oftentimes, especially with cats and dogs, it's actually the opposite. Depending on the individual animal and the individual situation, sometimes an injectable that you just give once a week or once every few weeks, depending on the type of medication, is way less stressful on an animal than having their face messed with and getting liquids or pills down their throat. And so it's something to consider. And even though it's different than what we think, so many people say, well, I don't want to be selfish. I don't want to keep them alive because I don't want to be selfish. Well, if you don't want to be selfish, consider an injection. Because even though for you that sounds more invasive and more dramatic, it might not be. Okay, so all three medications that this baby is on that are currently in pills, which is something that this cat just hates, could be given by a different route. It just so happens that all three of them would be a different route from each other, but all of it, I think, would dramatically increase the quality of life of the animal because he's not being grabbed and given stuff. I think it would increase the joy the family has during this time of life where they're just loving on this baby the best they can and keeping him comfortable because they're not feeling like they're burning the bridge. Because now, after doing the pill for a while, one of the family members, the one who was the best at doing it, therefore was always doing the medication, the cat sees her and kind of runs away a little bit. And that's not awesome, right? I mean, especially when you just want to love on them because you know you have limited time left. They've loved on us their whole lives. So that's one of my tips, is ask your veterinarian, work with your veterinarian. Is there an alternative? Another tip I want to give, besides the administration or delivery route of the medication, is the frequency of the medication. I'll give you an example. A veterinarian, when they make choices in medication, oftentimes there's more than one option. They will choose the one that they believe is the best option based on the information they have. A lot of times that involves the chemistry of the animal, the blood work and whatnot, the animal in front of them, what they believe is going to be the best route, the diagnosis, the prognosis, all of these things. They have, I don't even know, that's why I'm not a vet. They have all these variables that they consider. Now, the one thing that oftentimes they don't have, unless you give it to them, is your schedule. There might be a time when a veterinarian gives a 4 times a day medication. And by the way, there's another video, I'll put a link to it, that talks about how to handle giving 4 times a day medication. But they'll give the 4 times a day medication to a family that has they're 4 hours in the car every day just based on their commute, and they can't really afford somebody to come in the middle of the day to give them medication. And there might be an alternative that is 2 or 3 times a day that will work. It may not be the veterinarian's first choice, but that it could still be a very good choice for this animal. And what's even better is, because that medication is formulated differently to be given less frequently, and what I know from anecdotal experiences is people kill themselves trying to get the 4 times in, and therefore burn out and stress out because they're going straight from work and whatever, and grocery shopping is failing, and cleaning the house is failing, and the life is just revolving around getting these medications in. Or what also happens is it just doesn't get done, and then that animal is not being medicated because of things like the half-lives of medication. You can research that if you're interested. The medication frequency matters, and it shouldn't be messed with. In fact, there's some medications that if you don't give them as prescribed, whether you're giving them more often, or specifically in this case we're talking about less often, you're actually causing great harm, and we could be hurting our animals. And I know that we're not hurting our animals on purpose. Okay, so our tips so far, we're going to evaluate what we're giving. We're going to prioritize what we're giving so that we know. We are going to consider our delivery route. Can the medication be given a different way, or is it fine the way we're giving it, and we just want to know these other ways exist? There's lots of different ways to give medication. And then the frequency. What is the frequency of the medication? Could it be different? Do I need it to be different based on our whole family and how we manage this? And sometimes that frequency and that delivery route play in together. So compounding pharmacists can really be a great friend of your veterinarian. Those are my tips. This is all about medication, our conversation about medication. I hope you have a wonderful day. If you have any questions, if you and your pet are going through something specific and you have some questions, feel free to reach out to me. I love hearing about your babies. I love getting to know you. You can find my email, robyn@animalrn.com. It's on here somewhere. You can also reach out to us on Facebook. We love to talk to you there, and I hope you have a wonderful day. Good luck giving your medications, and if you're having trouble giving the cat a pill, don't worry. It could be a thrill with a different route or different frequency. Have a great day.